Thank you all for joining us today. This is the first session of our open enrollment webinars for members for the UC plan in 2026. As I'm pulling up the presentation, I do want to remind everybody, we actually do have 2 other sessions available. So if for any reason you have to go offline or leave this webinar, we are recording it, but there are also 2 other sessions available. So you can go back in and register to attend one of those if you need to have a follow-up session, you'd like to refresh or listen again, or if you do have more questions that come up after the event. We're going to go ahead and get started. So I am sharing my screen. Today we are gathered to talk about the new 2026 open enrollment for UC Care and HealthSavings Plus, the PPO plans, with the new partnership. We're going to start with Blue Shield of California in 2026. As I mentioned at the beginning of the call, we will not have the chat function going during this event. So if you have questions, please submit them through the Q&A. Today, we're going to talk a little bit about your 2026 benefits at a glance. We're going to review the benefits that you do get with Accolade when you're enrolled in a PPO plan. We're going to talk about what exactly is changing in 2026. We're going to review finding providers within the new Blue Shield of California plan. We'll go over an overview of your PPO plans with your RX benefits, detailing into Blue Shield and Navitas specifically. And then we'll also go over some member tools and resources available to you throughout the open enrollment period. As you all are probably very aware, there's going to be quite a few changes in 2026 with the UC plans. We have Blue Shield of California that is coming in. They will be replacing Anthem as the medical carrier for the non-Medicare plans. Blue Shield of California will be taking over the claims administration, the utilization management, and provider network management for the UC PPO plans. As you can see on this screen, we do have up and ready to go. There is a transition page that UC created that goes over all of the information that you need to know when transitioning from a current PPO plan with Anthem over to a new Blue Shield of California PPO plan. The transition page will go into a little bit more detail on the next slide, but there is a ton of information on steps you need to take, what you need to be proactive about, and also what are the plans doing behind the scenes to make sure everything moves smoothly. For example, we are working currently on making sure that we have all approved prior authorizations and gap exceptions that are already approved through Anthem and Accolade today. Those will be transitioning over to Blue Shield in late December. As a reminder, there are several letters that were sent out to members recently. I believe they were sent out starting October 20th. Those letters talk about members who might be experiencing some network disruption, if they are currently enrolled in one of the plans that is going to be terminating, the UC HSP or Health Savings Plan, and the core plan will be ending on 12/31/2025. So if you are currently enrolled in one of those plans, you should have received a letter notifying you that those plans are terminating. If you do not take action during this open enrollment period and you are enrolled in the HSP or core plan, you will be automatically put into the new Health Savings Plus plan. With these changes, Accolade will remain in place as your member services, also hosting the care advocacy and the virtual care benefits for medical and behavioral health. Starting on 1/1 of 26, there will be a new plan coming in, Health Savings Plus. Health Savings Plus is an HSA compatible PPO plan, very similar to Health Savings Plan that we have in place today, but there are some changes that are being made. It will still have an HSA paired with it that is run by Health Equity, and we'll go into some details about the Health Savings Plus plan. For UC Care, There are minimal benefit changes happening in 2026. So if you are in the care plan today, you should not expect to see many changes for the next year. We will go over those changes. Navitus, similar to UC Care, has not experienced too many changes. We will have a couple coverage changes that we'll go over when we look at the Navitus section. And for 2026, Win Fertility will remain in place as the fertility and fertility specialist. I want to point out that in 2026, Win Fertility will be owning all of the prescription formularies. They will be doing the pharmacies and providers. All of that is provided through Win. For those of you who have been in a PPO before, any lifetime cycles that have already been used, or if you've exceeded or maximized your 2 lifetime cycles, that will carry over into 2026 for Win Fertility. So those lifetime cycles will not restart in 2026, moving over into the new plans. If you do have any questions about Win Fertility, we encourage you to reach out to Accolade. We can get you in touch with Win Fertility today, and they can help answer any questions that you might have. Up in the top right corner, you see a blue button. This is a direct link to the UC Open Enrollment site. I strongly encourage everybody, if you haven't already gone out there, the Open Enrollment site is created with a ton of resources, links to the vendor partners, information. You can see side-by-side comparisons of the different benefits and what the different plans look like. Wonderful tools to help you research and really get to know and understand the benefit plan options ahead of you and how to make those decisions. And hopefully going over some of this today will also help with that. We're going to show a little bit on the transition page that we have put up for those of you who are moving currently enrolled in a PPO plan over to the Blue Shield of California plan. So UC and Blue Shield have put together a transition page. We have the link here on the screen. This page, there are multiple pieces of information and resources available to you, things that talk about what you need to be able to do, what do you need to be aware of, what resources are available to you. There has been a ton of work done proactively with UC and Blue Shield to ensure that we are really ready for the 2026 plans. There's been a lot of thought put into how to message this out to the UC population, make sure that we're identifying people and doing special outreach. So, for example, many of you may have received in the past week or so a transition letter notifying you that you are currently seeing an Anthem provider that is not currently enrolled in the Blue Shield Plan of California. You might have also received a letter if you are currently enrolled in the HSP or core plan, reminding you that those plans are terminating and you need to reach out and make sure you pick a new plan, or you will be auto enrolled in the HealthSavings Plus plan. We also have been reaching out to anybody who has a current gap exception in place to notify them that those gap exceptions will be transferring from Anthem over to Blue Shield. And you should have been notified by Accolade of the status of your gap exception and also what needs to happen next. Please note going forward, if you have an open or approved gap exception on file with Accolade, this will begin to show up in your Accolade mobile app. So please make sure, if you haven't already, if you're enrolled in a PPO plan today, make sure you download or register on the Accolade mobile app or Accolade member portal. This is where all of your gap information is going to live in the message center going forward. I want to also call a special notice to the timeline. You can see this is a screenshot of the Blue Shield transition page. This is a great timeline to look at so you can see what to expect when notices are going to be heading out, when you can expect to see your new ID cards. Note that we expect those to go out the week of December 22nd. It's very important. We're trying to get everybody their new Blue Shield ID cards as early as possible because it's very important for you to share those new IDs with your providers as early as possible. On the transition, you're also going to be able to have links where you can check out what status your current providers are in with the Blue Shield network. So for anyone currently enrolled in a PPO plan, if you plan on staying in that PPO plan, please make sure you are checking out the transition page out on UCNet so that you get all of the information about what to expect during the transition and what questions you might have. I'm going to briefly go over the Accolade services. We do have people on the call who are not currently enrolled in PPO plans and are thinking about it for next year. If you're enrolling in one of the UC PPO plans, you automatically get Accolade as one of your benefits. Accolade, we provide a variety of services to the UC population. We are the dedicated member services. So on the back of your card, when you reach out to member services, you're reaching out to the Accolade team. We are going to continue to be the first point of contact for member services in 2026. We will continue to have our dedicated care advocate team who are able to provide personalized support to help you understand your plan, address any claims issues you might have, and help guide you through the healthcare process. We will also continue to have our clinical support teams who are able to work closely with healthcare providers, members to ensure you receive timely and effective care. This includes managing care plans, tracking your health progress, and providing expert advice on managing chronic conditions or complex medical needs. Through Accolade, you will also be available for virtual care with Accolade Care. This is going to be for the UC Care and the Health Savings Plus populations. This is for you and all your family members enrolled in the PPO plan. With Accolade Care, you can connect with doctors and therapists virtually, ensuring they receive the care they need, no matter where your members are, what they're experiencing. We really do encourage you to use this service not only for urgent issues, but you can use Accolade Care for preventative and ongoing chronic care. Just making sure you have a trusted partner in managing your long-term health. On the next slide, we're going to talk a little bit more about 2nd.MD, another service available to you through Accolade Care. 2nd.MD is a virtual second opinion service. This is provided at no cost to members that are enrolled in the UC Care and upcoming UC Health Savings Plus plan. This is available for all members and their dependents. 2nd.MD and Accolade partner with top specialists in the nation, including doctors from the UC medical system, to consult with difficult cases. We have a network of over 1,000 specialists ready to provide comprehensive support across a wide range of medical issues. Whether it's a new diagnosis or needs for ongoing care, our team is here to support you and your families with high quality insights and expert opinions. It is important to note that 2nd.MD consultations are educational in nature. Our specialists do not treat the patient, prescribe treatments, or provide prescriptions. The service is entirely free for you and your families, and it really is just there to help give you easy access to expert advice without any additional costs. Virtual care through Accolade is going to be very similar as it is today through Accolade Care on the Health Savings Plus and UC Care plan. All virtual visits for preventive care are absolutely at no cost to the member. As I said, you can use virtual care for your annual wellness visits, preventive visits. You can select to see the same provider each time. That is all available to you in the virtual care options. In Health Savings Plus, if you decide to use virtual care for primary care, urgent care, behavioral health therapy needs, the cost of the visit will be $30 per visit before your deductible is met. After you meet your deductible on Health Savings Plus, each visit will be 30% of $30 or $9. On UC Care, if you decide to use it after preventive care for urgent care needs, medical behavioral health, we are continuing to offer the first 12 visits for medical urgent care and the first 12 visits for behavioral health therapy at no cost. So the first 12 of the medical and the first 12 of behavioral health, all provided at no cost. Should you decide to use the virtual care beyond visit 13, you will be billed the $115 cost for each visit. And you will be submitting those bills directly to Blue Shield for reimbursement at visit 13. Accolade Care is a great resource if you need to access doctors on the go, and please make sure that you download and get all your Accolade Care up to date, because I promise you, if you go to use it the first time when you're not feeling well, the last thing you're going to do is want to do a registration. So get the registration done and it's ready to use. Now on to a little bit more of the main event. We're going to talk a little bit more detail about what's changing in 2026 with your UC benefits. As we already talked about, Blue Shield is coming on as the new plan administrator for all of the UC PPO plans. Core and UC Health Savings Plus are both terminating at the end of 2025. I apologize, I believe that's an error right there. It is supposed to be 2025. Health Savings Plus is a new PPO plan that is compatible with the Health Savings account. It is going to replace both the HSP and Core plan. During open enrollment, you do have a choice of what plan you'd like to enroll in. For a reminder, there are the two HMOs through Kaiser and HealthNet Blue and Gold. And then we have the two PPO options, UC Care and Health Savings Plus. If you do not choose another plan for 2026 during open enrollment and you are currently in the Health Saving HSP and Core, you will auto enroll into Health Savings Plus. So please, if that is not the plan you want to enroll in, you must take action during open enrollment. There is one exception that I want to make note of. If your household includes both Medicare and non-Medicare members, Health Savings Plus is not an available benefit for you. This includes those that are still working but have Medicare or covered family members with Medicare. You should review your plan options, as Health Savings Plus is not available for families with Medicare. If you do have any questions, feel free to reach out at any time to Accolade or to your resources within UC. Health Savings Plus, as noted, is replacing the Core and Health Savings Plan with new benefits and costs. Health Savings Plus was designed to be UC's lowest premium medical plan, and it will include the Health Savings account that lets you set aside money for health expenses while lowering your taxable income. The HSA is a really smart way to be able to use money for qualified medical expenses, and the account will stay with you forever. You do not lose the money at the end of the year. It will roll over. You will not have to worry about the end of the year scramble, and that money will stay with you even if you decide to leave UC. UC is also helping get everybody started with their health savings account by contributing money directly into your HSA at the beginning of the year. Contributions for individuals of $750 and families $1,500. For those of you who are thinking about Health Savings Plus and you're interested in really how does the HSA work, you have questions about the HSA, Health Equity, who is the benefit manager who oversees the HSA on the Health Savings Plus account, they are hosting several webinars. I have a QR code and a link listed right here on the screen. The first of these webinars is actually happening today at 2 o'clock. So I encourage you, if this is something you're interested in, please make sure you register for one of those HSA webinars. It's a great way to get you in. If you've never used an HSA, you can ask questions and it gets you more familiar with how to use it, especially with a new plan in the year. So if Health Savings Plus is something you're thinking of, please make sure you register for one of the HSA webinars. That will be very helpful when doing your open enrollment. A little bit more about what's changing. As you know, with a new network, there's a lot of concern around whether or not your current provider is going to be in the new Blue Shield of California's network. Thankfully, we are very happy to report that 98% of all of the Anthem Blue Cross providers are also in network with Blue Shield of California. Blue Shield's large provider network includes most of the doctors you're currently seeing today, along with all of the UC health providers and facilities. So that's really going to be a low rate of disruption, and definitely that was something that UC thought of making sure it would not impact members greatly. However, you may experience a change in network of providers. So I strongly encourage, if you have a provider or you and your dependent are seeing somebody in the past year that is not currently in the Blue Shield of California network, you should have received a letter from UC in late October letting you know. If you have any questions about the network disruption letter, you are always able to reach out to Accolade. We're able to do searches within the Blue Shield of California network. You may have gotten a letter for a provider you're no longer seeing. I think that the decision really was to err on the side of over communicating. So if you received a letter for a provider you're no longer seeing, that's okay to disregard it. Please note, though, that going forward, we really want you to use the Blue Shield of California provider links, which we have a little bit later in the presentation, because that is going to give you the most accurate information. We really want you to, if you are seeing current Anthem providers, make sure you check the status of your providers in the new Blue Shield searches. It's good to know ahead of time what providers are going to be in the network if you do have any disruption and what the steps are to make sure to set up new providers. We also want to make sure you know we do have a transition period. We understand for some people it might take a little bit to get transferred over into a new provider if they have to. We're going to use the first 90 days to kind of work as a transitional period of getting people hooked up with the right providers, the right specialists as we move over into this new network. But I do encourage everybody, if you have questions, or you'd like to start looking for your providers today, those links are open and live for you to go in and look in your area to see which Blue Shield specialists are around you. And as a reminder, we will be moving all existing approved prior authorizations from Accolade over to Blue Shield for 2026. Today, all of your utilization management and prior authorizations are conducted by Accolade. This process will be moving over to Blue Shield of California. So all of your prior authorizations, all of the any surgeries that need to be reviewed and approved, anything that needs to be reviewed for medical necessity, that is all being done by Blue Shield of California going forward in 2026. But if you have something that's already been approved through Accolade, that is all transitioning over. We will be doing that directly with Blue Shield to make sure that that is all over, and you will not have to do anything as a member. That will be sent over, and your existing prior authorizations will be honored. If you or a covered family member is currently in a course of treatment, for example, the third trimester of pregnancy, or you're undergoing chemotherapy or being treated for an acute short-term condition, we will make sure that you are able to continue to see your current provider through the end of March at the in-network coverage level. We don't want to penalize anybody or make somebody switch doctors in the middle of important treatment. So please reach out to Accolade if you have any questions. We will be connecting with people and making sure that we have everything set up as we go into December. Prior authorizations that you receive for services after January 1st will remain valid. Again, if you have any questions, please reach out to Accolade, and we're happy to look into the system. We're happy to get your information and make sure that you have all of your answers or your questions answered. We do have a change coming in 2026 regarding weight loss medications. Weight loss medications can include GLP-1s, medications like Zepbound, Wegovy, appetite suppressants. The new criteria that is being put on all weight loss medications is that it does require a pre-treatment, so before treatment has started, a BMI of 40 or higher as part of the prior authorization process. This is new, so this is for weight loss only. Please note at the bottom that this is not going to impact the current GLP-1 coverage for people living with diabetes. This is for weight loss only. Any of the PPO members currently on any kind of weight loss medication, there is a possibility to continue treatment, but you have to go through the new prior authorizations through Navitus in order to have it reviewed to see if you will meet the new criteria. So for anybody who is currently on a GLP-1 or weight loss medication, please make sure that you know to reach out to Navitus before January 1st to go through the new prior authorization process to make sure you meet the criteria to be able to continue. So there's also a new process starting regarding access guidance services or manufacturer copay assistance. This is going to be a mandatory program for several high-cost medications with manufacturer copay assistance. This can include medications such as some HIV medications, specialty drugs, and some GLP medications. You should have received a letter in late October to say if a drug you are currently taking qualifies for the mandatory program. If you're newly enrolling in plans and are on any medications you feel fall into any of these categories, please reach out to the Navitus Access team on the screen, the bottom of the screen, to assist you with your questions and enrollment instructions. The reason that this is being added is we want to really make sure we help reduce costs and we want to please begin setting this up with Navitus on your existing prescriptions and make sure we know that all new prescriptions are going to be reviewed as well. For anybody who feels they might have a drug that falls within this category, or if you received a letter notification around the end of October, please don't forget to reach out to Navitus to get set up for the mandatory program that will be starting in 2026. They're going to be able to answer your questions, review and make sure that your medications require you to be on the new copay assistance program. And as a reminder for these, only payments made by the members are going to count towards your out-of-pocket maximum. Any of the amounts or the discounts that you're getting by the manufacturers, those are not going to count towards the out-of-pocket maximums or deductibles. If you do have any questions, the Navitus Access Team information is there at the bottom, and you can reach out to them to check your medications and talk about enrollment in the program. We're going to go into now talking a little bit about the new Blue Shield Find Care Provider tool. I want to start off saying that I know we've heard several people have shared over the course of the past couple of years there's some concern or it's not always clear what tier status a provider is. We know there's been some concern around, is this a tier one or a tier two? The network and the Find Care tools are not always very accurate. A lot of that feedback went into the preparation of the Find Care tool that UC and Blue Shield created together. This was created to make the process easier, to make it very streamlined, and to remove a lot of the uncertainty and questions around the tier status of different providers. So going forward in 2026, we're going to make it super easy to find a tier one, a tier two, or a provider in the HealthSavings Plus network. Blue Shield has created 3 distinct links, and you can see them there on the screen, 3 distinct links to find a different tiered provider. We understand, again, there's a lot of frustration and confusion around this. To make it simple, we put it into 3 links. So if you're looking for a tier 1 provider, you would simply select the UC Care Tier 1 provider link, search in your area, and that will pull up all of the tier 1 providers in where you're looking. If you're looking for a specialty in your area and you're not seeing it pop up in the tier 1, you will then have to drop down to the tier 2, but that will give you all of the tier 2 providers in your area. Those 2 links obviously are going back to the UC Care program, but this was a very clear distinction between who is in the tier 1 and who is in the tier 2. Please note that tier 1 providers are only available in California. You will not be able to, on the tier 1 search, you will not be able to search for providers outside of California. If you try, you'll get a little pop-up notifying you that there are no tier 1 providers in California and help you redirect you to finding providers outside of California. The Tier 2 network and the Health Savings Plus network does have all California providers as well as network coverage across the US. Please note that it does sometimes take time when going through the contracting process. We have UC providers going into the network all of the time. Our provider team at Blue Shield of California works very hard to pull those contracts, move them through as fast as possible. But just know it might take a little bit to get into the system. If you do know of a UC provider who is not showing up in the Tier 1 link, please let us know. Reach out to Accolade. Let us know. We're able to coordinate and collaborate with Blue Shield of California to get the provider services team over at Blue Shield involved to help push that contracting process a little bit faster so we can get that UC provider in the system and linked into the Tier 1 provider link up at the top. I'm going to show you a few slides of what the provider tools looks like, and then we're actually going to do a quick demo so you can see a live demonstration of how this works. So in this example, you select the UC Care Tier 1 link. Step 2, it's going to pull up its own page where you can find doctors and services. You're going to enter your location, so that can be your city, your state, your zip code. The middle section that says UC Care Tier 1 will not change. You are going directly into the Tier 1 network from that link, so it will not change to a different network status. It will look only in the Tier 1 network. And then you can look by doctor's name, specialty, um, condition. You'll be able to put in cardiology, pediatrics, dermatology, or look for Dr. Jillian Duke. After that, you're able to select the type of provider and facility type. So there'll be some drop downs below. This will give you the opportunity, if you're not exactly sure what you're looking for, it can kind of prompt you to look around and see exactly what kind of specialty and provider you are looking for in that link. And then finally, it will pull up a list of providers who are in the Tier 1 network. It will be generated for you. You can refine your search by the different tools on the left-hand side. It will give you a link to who is also accepting new patients, as well as information about confirmation that they are in the UC Care Tier 1 plan at the bottom of the page. As I said, we're going to go through a live example. So these are something you can look back on to use as a reference when looking for providers. We do encourage you to start using this now to check your current providers to make sure if they're in the network, and also to get a good idea of the number of Tier 1 network providers in your area. When you're looking for doctors outside of California, we definitely want you to call out a few things. Number one, there are not going to be Tier 1 providers available outside of California, but you will use the Blue Shield tool to find those doctors outside of California. We can walk through step one. You're going to enter your city and state and then select Find Care. For care provided outside of California, but within the US, the search will take you to the Blue Shield Blue Card program. Your plan benefits remain the same in and out of California. There's really no change. It's going to have the same in-network preventive care at no cost. You must meet your deductible first. The plan will pay the same percentage of the cost for the covered services as if you receive it in California. Out of network coverage is available, but we don't recommend going out of network. You tend to you'll have a higher deductible, a higher member cost share. Members will need to submit their own claims, and there's a lot of risk and subject to balance billing. So whenever possible, staying in network is the best option. That allows for Accolade and for Blue Shield of California to advocate on your behalf. Make sure you're not getting overbilled, make sure all of the claims are correct, and make sure those providers are following the guidelines they agreed to when signing contracts with Blue Shield of California. Okay, we're going to do I'm going to stop sharing real quick. We're going to do a quick live demo. So for those of you on the phone, We are going to do a tier 1 search. Let me get this pulled up and then I'll reshare my screen. But I'm doing a tier 1 search simply by clicking the link UC Care Tier 1. As you can see, it is pulled up directly to the UC Care Tier 1 provider search site. I'm going to find a doctor in Oakland, California, and I'm going to look for a doctor in dermatology. As you can see, the specialty has popped up below. Am I looking for pediatric dermatology, regular dermatology? Am I looking at specific medical groups associated with dermatology? For this search, I am going to look at just the dermatology specialty. And it's going to pull up for me a list of the providers, and all of these providers are on the tier 1 link. Therefore, they are tier 1 providers. I can come up to these filters and go for those accepting new patients. Click that to make sure I'm getting people who are accepting new patients. And I can change at any time my search radius. It's set at 15. I can take it up to 50 or 100. I'm able to talk about if I need additional languages. I need maybe somebody who speaks fluent in Spanish. You're able to put that in, and it will bring up the list of providers in your area that are UC Tier 1. So I'm going to click into Dr. Isaac here. When you click into each of the doctors, it's going to bring up their very specific page within the Blue Shield of California. As you can see, specialty is dermatology. They are showing in-network, accepting new patients, and then here's some more information on this provider. 25 years of experience. They do have English and Spanish speaking in the office. And then if you're ever curious when you're on this site, you can scroll down. Here is the location. We have 2 locations that are in the Tier 1 network. When doctors practice at multiple locations, and I'm sure many of you who have been on the PPO for a while have heard this, your location and your provider status, it greatly depends on what location. You might have a doctor who is in location at 3 out of the 4 locations they practice. So knowing what location is in Tier 1 is very important. So for those of you who call a provider and they say, that's fantastic, we can get you an appointment. What is it okay if you go to this location over that? Make sure you pay attention, because for this doctor, his 3100 San Pablo Avenue, Suite 400, and his 400 Paranas Avenue, Floor 2 are in network. And you can see, because you scroll down to the bottom of the page, in selected plan UC Care Tier 1. As long as it's still down there and you use the Tier 1 link, you will always pull up UC Care Tier 1 providers. Now, if I were to look in here and say I'm going to change this to Miami, Florida, I'm in the Tier 1 link. You're going to see searching outside of California. Here's how to find out of state care. Click that link, and it's going to take you to the Blue Shield, the Blue Card outside of California. Find a doctor or other provider in your network. I'm going to click Find Care, and it's telling me I'm leaving the website. And I want to go to Miami, Florida. When it asks for these digits, when you guys get your new ID cards, you're going to see the first 3 digits of your ID number are going to have alphabet numbers. For UC, it is going to be UCD. And then you can browse a list of plans. And then you can search by your doctors. So if I want to find a primary care doctor in this area, oh, I think I'm searching by doctors' names. I apologize. If I wanted to go by specialty, I could go primary care. primary care physician, and here we go. Now, because outside of California, there are no tier one benefits, you just have to make sure that you are seeing that doctors that are in the Blue Shield network in network for that Blue Shield option. They're in network. They are on the tier two for UC Care, or they're part of the full Health Savings Plus plan. I wanted to make sure we did a short demonstration so you could see what the provider search looks like in real time. All right. So for those of you, again, who are currently in a plan, you're going to be able to go. Okay, let me see just 1 second. Okay, so for those of you who are looking for doctors outside of California, we do have these steps that you can follow with the UCD. But of course, at any time, if you have any questions or need help looking for providers in California, outside of California, you can reach out to Accolade. We're happy to help you through that process. For those of you who are looking for information on international coverage, there is going to be coverage available for both the people in plans of the UC Care plans and in the Health Savings Plus plan. You do have coverage outside the US. I do want to call out all of the care through, if you're going outside the United States, must go through first the Global Core Services Center. And you'll see that number down there in the bottom right-hand corner. If you plan on going on a trip, you're going outside the US for pleasure, you're going out for a long stay, or if you're going to be living outside of the US for some extended period of time, please make sure you have that Global Core Services number on you. If you are going to the doctor or hospital for any reason, that needs to be one of your first calls. Global Core works directly with the doctor, the hospital, the facility outside of the US to help obtain what's called a guarantee of payment. If they are able to get that guarantee of payment, you are only paying your coinsurance and leaving. We will work with Global Core will work with them to make sure that they have that guarantee of payment set up so that that facility or doctor knows that we are going to process and pay the claim. Global Core will work directly with them to get the claims, get the invoices, get the bills, get everything translated, and do the work on your behalf. If you are going outside and you have services, urgent services, and you don't call Global Core, but then you get a bill, an invoice that you're trying to submit for payment, it is very, very difficult to go backwards in the process because you've already paid that claim in full. You've already paid the doctor in full, and the doctor is there's not a lot of reason for the doctor to work with us. So I want to strongly remind everybody, if you plan on traveling outside of the US, please have the Global Core number with you. Your insurance will cover UC Care at 20%, Health Savings at 30% after deductibles have been met. And this is for routine and emergency situations for both plans. Here is a look at what your new cards are going to look like on the Blue Shield plan. This is an example of a UC Care card. Again, these are going to be coming to you all for the whole week of December 22nd. Here's your Health Savings Plus plan. Everything is pretty much the same. As I mentioned, Accolade is going to continue to be your member services. One difference will be that on the back of these, for providers to call for a prior authorization, it will have a new number that will reach out to Blue Shield of California for their utilization management department. We talked briefly about transition of care, but as we mentioned, we will be transitioning all existing prior authorization and gap exceptions over to Blue Shield for 1/1. There is no action required by you. We're going to be doing this on your behalf. I did want to dive a little bit in. If you have any questions about the transfer, if you have an authorization that you want to make sure is on, that we have everything ready, that everything's going to go over. If you have any questions on gap exceptions, please reach out to Accolade. We're happy to walk through everything we have on file, confirm everything that's going to be sent over to Blue Shield. But please note that this information is not going to be going over to Blue Shield until mid-December. We need to wait until every member has a new generated member ID so that we can put that on the prior authorizations and get them over to Blue Shield to have them loaded. We will have all of this loaded prior to January 1st, but this process will get started mid-December. When you're talking and looking at the PPO plan comparisons, especially for those of you who are fairly new, maybe you're looking for the first time at a PPO plan, out on the open enrollment website, UC has a great look at what we call plan comparison grids. This is an opportunity for you to look at the two PPO plans side by side and see what's new, what's different, how do they compare against each other. Really, what's different between the two plans, UC Care and Health Savings Plus, is that UC Care is a custom three-tier PPO plan. You have your Tier 1 or your UC Select providers. This consists of UC providers and facilities that are picked by the university. When you use a Tier 1 provider, you do not have a deductible, and it's a lower copay with an out-of-pocket maximum that goes up to $14.2 for families. Under UC Care, if you're not using Tier 1, you drop down to the Tier 2. Tier 2 is really your Blue Shield preferred network. Here you do have a small deductible for individuals and families of $500 and $1,000, and you must meet your deductible before the plan will pay the coinsurance on benefits. Tier 3 on the UC Care is almost always going to be the out-of-network benefits. As again, we're going to really strongly encourage you to try not to use out-of-network providers. When you do, there's really not a lot we can do on balance billing. It's a high risk, and we don't want to see you out a lot of money. So when possible, use Tier 1 versus Tier 2. On the Health Savings Plus side, this is a high deductible PPO plan that is paired with a health savings account. The health savings account is administered by Health Equity. On the Health Savings Plus plan, you will have a deductible for individuals of $2,500 and $5,000 for families. There is also an out-of-network deductible for the individuals and families. Again, hopefully you're not using out-of-network services. And then UC will contribute money directly into your HSA at the beginning of the year to help kickstart your health savings account. You're able to then put money in pre-tax to your health savings account throughout the year to help pay for deductibles, coinsurance, copays. And as a reminder, these deductibles are your pharmacy, their medical, behavioral health, all of that combined is your deductible. Your out-of-pocket maximum is the maximum amount of money you will pay out of pocket per year based on your claims. So it's very important to keep track of or to know what, once you meet your out-of-pocket maximum, everything else will pay at 100%. There will be no more cost sharing sent with you. And if you have questions about your deductible and out-of-pocket maximum, you're always welcome to reach out to Accolade. We will have full access into the Blue Shield network and plan and their system to be able to look at all of the claims and help find out where there might be any issues, concerns, or things that we have to have readjusted. For both plans, preventive care is covered at 100% when you use in-network providers. If you do decide to go out of network, you will have to pay 50% of the cost after your deductible is met. So it really is beneficial to stay in network for preventive care. I do want to call out that there have been in this past year, we've seen a lot of escalations with people who say they go in for their annual wellness visit and they're getting a bill. There is a difference between preventive care versus diagnostic care. So we have some great resources available. We do go into this in our monthly webinars, but a really good rule of thumb is Preventative care annual visits is when you're not trying to diagnose something. You're not looking at your new symptoms. You're going in, you're doing kind of a where am I at? And if you start asking questions or they start looking at different symptoms you're having and trying to diagnose what those symptoms might be a sign of, that is when your preventative visit will likely turn into a diagnostic visit. If you have gone in for your annual wellness exam, and if you have any questions about how that was billed or what's going on, again, please reach out to Accolade. We're happy to reach out to the doctors and the billing, make sure everything was billed correctly, make sure everything was done correctly. And if there are any things that we can do to help get that reprocessed, we are happy to do that. On the regular doctor and specialist visits, the UC plan, there are the three tiers. So if you do use a UC Select Tier 1 provider, it is only a $30 copay per visit. If you go into the Tier 2 network, which is the Blue Shield preferred providers, that is 30% coinsurance after your deductible is met. And then out of network is going to be a 50% coinsurance after your deductible is met. For the Health Savings Plus, everything in network is 20% coinsurance after your deductible is met, and then 50% after deductible is met for out of network. And again, on the Health Savings Plus, you're able to use your health savings account to pay for those deductibles and those coinsurances on your Health Savings Plus plan. Same with hospitalization benefits. There are three tiers for UC care based on whether you go to a UC Select Tier 1 facility. It would only be $250 per admission. On Tier 2, it's 30% admission after the deductible is met. And of course, out of network is 50%. On your Health Savings Plus plan, your responsibility would be 30% coinsurance after the deductible has been met for in-network facilities. Out-of-network facilities, you're going to be responsible for 50% coinsurance after your deductible has been met. And then for coverage outside the US, it is 20% and 30% after deductible has been met. The pharmacy has a lot of information on it. There's a lot of details here. Overall, what I can tell you, what we're going to go over is for your pharmacy drug benefits, the payment is going to vary by tier. So it is important to pay attention to the pharmacy location, what that tier benefit is, and changes depending on if it's a 30, 60, or 90-day prescription. For UC Care, the preferred pharmacies are select UC Medical Center pharmacies, Costco, CVS, Safeway, Vons, and Walgreens. You are able to use Costco for your mail-in prescription orders. And then if you're looking at specialty networks or if you need specialty information, that can be provided by some UC medical pharmacies as well as Lumicera. But if you have questions about specific pharmacy drug coverage, you can go to your open enrollment page. You can go to the Navitus page and look at the different tiers and what those costs are going to be. You, of course, are going to have a lower cost share if you use a Tier 1 facility and if you're using the preferred pharmacies for UC. So there are a variety of ways for members to fill their prescriptions. The retail pharmacy network does include over 64,000 pharmacies, including the major chains we just went over. For UC Care members, preferred pharmacies do include the UC pharmacies, Costco, CVS, Safeway, Vons, Walgreens, and Walmart. Using the preferred pharmacies will give you a lower copay for a 90-day supply. All of your mail order pharmacy goes through Costco. This is the preferred mail order pharmacy for all plans, including UC Care and Health Savings Plus. You can register at pharmacy.costco.com, and you do not need a Costco membership in order to use this service. As I mentioned before, for any specialty medications in the UC Care and the Health Savings Plus plans, members must use a UC specialty pharmacy or Lumicera Health Services. If you need to reach out to Lumicera, we do have their information there on the slide, and you're welcome to reach out to them if you have any questions about any of your prescriptions or drugs that you're currently using to make sure that, if they're the ones that they need to help you or how you're going to get those medications. And please don't forget to check if your specialty HIV or GLP-1 prescription has an applicable manufacturer copay program. You will have to enroll with Navitus if you do have one of those drugs that is going to be part of the new Navitus manufacturer copay assistance program. I feel like we've covered a lot of information. So I'm going to go over a couple of tools that we have for you to hopefully make this a little bit easier, help guide you where you need to go. And of course, we'll have some time to go over questions that have not gotten answered. We do on the Accolade member portal and the Accolade app, we do have an annual open enrollment guide up today. So this is a quick at a glance. If you're somebody who is currently enrolled in Accolade, you can go there and see your open enrollment information. We do have some comparisons available so you can look at what the different plans are, a review of what's changing for next year. So that is available currently on the Accolade app and member portal. As I said earlier, we do, if you're somebody who has the PPO plan today, it's very important to download the Accolade app and member portal and make sure you get your registration completed. There are several reasons why this is so important, but really the big one is we're able to then, you have an opportunity to share with Accolade the way you prefer your phone and mail contact information. When we get information over, we don't always get the best email for members or the best phone numbers. If you need support or help, it's great for you to be able to go in there, give us your preferred contact information, and we have a messaging center where a lot of this new stuff is going to be hosted. So if you have questions about your gap exception, or if you want to chat with your care advocate and ask, hey, I need help finding a new cardiologist in the San Diego area in the Blue Shield program, you can chat with a care advocate and get that information right there in the message center. So there are a lot of great resources in the Accolade app and member portal. We are enhancing greatly over the next year the digital experience in the app and the portal. So if you're registered, you'll get to use those great enhancements. And if you ever have to call or reach out to us, we have our dedicated UC number of 866-406-1182. We also have a special connection with Blue Shield of California so that anybody who is enrolled in the Accolade app, they're able to SSO or single sign on over into their Blue Shield portal, which is great because that you can see pretty much everything you need in the Accolade portal, but there's some incredible enhancements and incredible tools that you could have that you'll have access to on the Blue Shield portal starting in 2026. Number one, you can download your EOBs from the BSC portal. You can download or order new medical ID cards. You can view and open all of your prior authorizations, and you can view all of your plan documentation, your SPDs, SBCs on the BSC portal. So as long as you're open and enrolled in the Accolade app or member portal, you'll be able to click those links and SSO right over into BSC and not have to sign up every time you go over. If you're somebody who is currently on the Accolade member app or portal, please note you cannot sign up for BSC or your Blue Shield of California until after 1/1. We have to get your ID cards out to you before you can create an account. So please, don't try to go out and create a Blue Shield account today. It will not work. We have to wait until 1/1. But once we hit January 1st, those will combine and you'll be able to access both of those. Similar to anybody who is out there and is looking at enrolling in a PPO for the first time, please do not create an Accolade account or a Blue Shield account until after 1/1. Navitus also has some great member resources available as well. They have a dedicated phone number so you can contact the Navitus customer care team. That team is available 24 hours a day, 7 days a week, and they operate on a first call resolution basis. The Navitus customer care team can address a wide variety of issues. So they can talk about what your drug coverage looks like, ordering your member ID cards. They can even help you with troubleshooting a rejected claim with a pharmacy or faxing paperwork to providers. You also do, if you're currently enrolled in a PPO plan, you can set up your own member portal and your own member mobile app access for the Navitus account. This is for current members only. And again, it allows you to do that drug lookup. You can look at your medication history. You can use it as a network pharmacy locator and also doing your different member forms and a digital member ID card. What's really exciting is for open enrollment, for those people who might be thinking about moving over to a PPO plan or getting Navitus for the first time, you do have access to the Navitus pre-enrollment site. So you can see a screenshot right there on this on the slide. This is what the pre-enrollment site looks like. As you can see, you've got the UC Care button, you've got Core, which will go through 2025, UC HSP, which is through 2025, and then down in the right-hand corner, you have the new HealthSavings Plus. This gives you the opportunity without enrolling. You can be someone who's not enrolled in a PPO today. Maybe you're thinking about it. You can click on that link below, get to this site, look at the different plans. For 2026, it would really be UC Care and HealthSavings Plus. And you can look up your drugs. You can look at the benefit information. You can look at pharmacies, find and do some cost compare in your area. But this pre-enrollment site is available for you today. If you're thinking about the PPO, this is a great opportunity and tool to get in there, find out what it could look like for you in 2026, and ask some questions. I also want to remind everybody that there's an incredible benefit that you have access to today. It's called Find Help. Find Help is an organization that helps people with that might be needing a little bit of extra help this time of year, or just in general with maybe they are having some trouble getting access to food or housing. They're having some transit issues or money issues or need help with paying for education. Any UC health plan member or family member that needs support with any of these social, financial, or physical health issues, they can reach out to Find Help. Find Help's their search platform will let you search for resources in your community. It's confidential, so you are able to do that with dignity and ease. If you're interested or if you know somebody who could use a little bit of extra support, please click on the Find Help link. Again, this is a confidential, wonderful service that is going to help with people who need those assistance with housing, food, or just access to some programs. So please keep this information close to you. If you know anybody who could use this information, please feel free to share. But Find Help is a tool that is there for you when you need it. So I have two websites on the screen that I want to make sure that we look at. Number one, on the right-hand side, you have your UCNet OE site. This is a site specifically put up to support open enrollment. Again, if you've not already gone out there and looked at it, there's great information. There's comparison grids. This is the tool and the site to use when you're going through open enrollment if you want to learn about the differences between the plans, if you have questions about why certain decisions were made, if you have questions about what your premiums look like, definitely go out to the open enrollment site. I also want to call out to everybody that while there are several open enrollment digital resources, UC has been sending out several letters for network disruption. If you're currently in a plan that's terminating, they sent a booklet to everyone that has great information about your premiums based on your salary band. And they're also sending several emails out giving you information about open enrollment and all of the resources available to you. So please pay attention and check out the online resource for open enrollment. Check your email. You've been getting some emails from UC with different details and call outs to help you through the open enrollment season. And also check your physical mail. A lot of things have been physically mailed to your homes to help if you've been identified as someone who needs to maybe be aware of or take extra action during open enrollment due to one reason or another. But closer to January 1st, the site on your left, the UC facility or faculty PPO site, this is going to be your first stop for everything UC PPO. They keep it updated, current. Right now, there is a link to the transition page going over to learn about the BSc transition. During the year, they have different promotions like the women's health promotion. Everything is stored on the faculty staff PPO site. I have bookmark it, pull it up, check it throughout the year. This is going to be your one-stop shop for everything UC PPO going forward to learn about what's coming. There's a lot of great things that they host and promote on this site. So again, if you're enrolling in the PPO plan, definitely bookmark that site because you're going to need the information throughout the year. Last but not least, I have a little bit of an open enrollment checklist here for you. So the first item, again, everybody go out and check that open enrollment site. So many great resources. Make sure you are reviewing the premium changes. Those are by your salary band and by the plan. So when you're looking at what you want to enroll and sign up for, please make sure you're checking your premium changes. That was mailed to you, but it's also available on the open enrollment site. Everyone gets a check off today for attending the member open enrollment webinar. If you do, there's a registration there. If you do want to come back or if you want to refer one of your friends or colleagues, there's the link to attend one of these webinars. Thank you all so much for joining us today. I hope it was helpful, but you got a check mark today. Don't forget, below that, we have at 2 o'clock this afternoon, and there's going to be others as well, the HSA 101 webinars hosted by Health Equity. The registration link is right there. Remember to use your BSc provider links, the Tier 1, Tier 2, and the HealthSavings Plus to check your current provider status and look for providers in your area. Don't forget to complete your open enrollment. You don't want to be put into a plan that you're not looking at. Make your choices. Make sure you submit them. Make sure all of your information is sent in and updated so everyone has good updated contact information on you. If you're currently in a PPO plan, make sure you have downloaded the Accolade app and you are registered. If you're enrolling in a PPO plan, please make sure you download the Accolade app and register after 1/1. After 1/1, please make sure you complete your Blue Shield of California portal registration. This is going to set you up for the single sign-on so you can go back and forth between Blue Shield and Accolade. Don't forget to notify all of your providers of your new plan changes. Bring that card, send it to all your providers, bring it to every appointment. You need to make sure your providers know that you have new insurance starting on 1/1. And then last but not least, contact Accolade if you have any questions. That is the dedicated UC line. You can call into Accolade. Don't forget with the new member portal and the app, you do have the ability to send messages in and have them answered so you don't have to sit on the phone. So you can get those messages sent over. Our care advocate team will get them answered for you. And we're trying to make sure that you get a lot of support during open enrollment, whatever way you possibly need. I am going to pause for a moment there and ask my colleagues if there are any questions that we need to go over on the webinar.
There are quite a few.
Okay.
Can you hear me okay?
Yeah.
Okay. So please be patient, everybody. I know that we're running out of time. We do have hundreds of questions. We will be answering all the questions, submitting the deck as well as the Q&A with responses out to all registrants of this webinar. So please be patient. A couple of things that I do want to talk about though is mostly the provider searches. So if you go out to the transition site, look through, there are many ways to answer your questions within the site. Also, you would want to click on the links for a provider search specific to UC Care and Health Savings Plus plan. Please remember, Jill is showing us on this slide here. Go ahead and go down to where the provider searches are. Here we go. Go up a little bit more. Right there. Oh, yep, there we go. Okay, so here you see 3 different links. UC Care Tier 1 and Tier 2 are all a part of UC Care. But if you remember when Jill was going through the materials, the UC Care, the select Tier 1 will give you all Tier 1 providers. This does not include all services in all areas. So if you're not finding what you need in this link, it doesn't mean it's wrong. It means you need to back out and use the Tier 2 link so that you can find all other Blue Shield national PPO providers. Okay. Now, the third link there is for the Health Savings Plus plan, and this will also give you the full Blue Shield PPO national list of providers. I also want to say that any providers outside of California are the same network that you use today outside of California with Anthem. The best thing to do is click on the links. If you're in UC Care, click on Tier 2 to find outside of California. There will never be Tier 1 outside of California. Please note that. In addition, this flyer is on the transition site. Jill is showing you these instructions are very specific for searching in California by plan on the left and across the US on the right. Please remember from each of the tiers on the left, once you start typing in an outside of California address, it will link you right over to searching across the nation, and you will enter in UCD as in dog. This will link you right over so that you can search all non-California providers. Okay, I did see a few comments stating that the provider finder doesn't seem to be working correctly. We've tested it over and over and over again. I cannot urge you enough. Please use these links. They do work and they make the search function very, very easy and very, very accurate. Let's see. I know that covered a lot of the questions that are still remaining. Let's see here. Please also remember, as with all carriers, allowed amounts for services are not shared. Please remember that Accolade is our front member services. So as a member of UC Care or Health Savings Plus plan in 2026, you will want to register for the Accolade member portal. Within the member portal, you will be able to single sign on over to the Blue Shield portal, and this is where you can find a cost comparison tool. So although the allowed amounts are not shared, they will give you a pretty close estimate by service and by area. So please do check that tool out once you are ready, once you're in the Blue Shield system. Please think about this. Many of the tools for actual members will not be ready until you're loaded into the Blue Shield system, which will not occur until the week of December 22nd. Let's see here. Thank you, Jill. Did you want to give some context on where you're going?
Yep. So everybody, I have just pulled up the open enrollment site. As you saw when you first pull into the open enrollment page, there is a video message about the changes. There's a frequently asked questions. So you can go in here and look at, a lot of the questions you're asking. response to rising costs, about the health savings account. You can click in here and you can see, different questions people have asked and what some of the answers are. So the FAQ is a great resource. I also want to point out that for those people who, when you come down here, we do have faculty and staff and enrolling and then retirees. So make sure that you're keeping track if you need to go the retiree route. This should be the faculty and staff route. To get started, I would just click through here. Honestly, it gives you a lot of great information. It shows you about Alex, which is a tool you can use. It's kind of a benefits counselor. You can go into look at the plan changes, the plan costs. You can look at information about how to enroll online. There's just so many resources in here that you can go in and look at. And I think the plan comparison tools are really important because I like to see things, the what's changing side by side. It gives me a good visual that I'm able to see kind of, right there. And I'm trying to pull up um, the different ones, but you can look in here and see all of the different things that are changing, and you can look at it side by side on the plan comparisons. So let's see plan costs. And then this will also, this is where you need to look. If you do not have your mailer, this is going to show you your premium costs. I'm going to pull up the full-time salary rate for 73,000 or less. This is going to give you what your premiums are going to be quickly. This is going to be the plan. So Health Savings Plus. It's going to also include the two HMOs, Kaiser and Blue and Gold, and then UC Care, self and children, self and adult, and then family. These are your premiums. Make sure when you're looking at your premiums that you are in the right salary range. These are done by salary bands, and you're looking at make sure that you're looking at the right breakout. If it's going to be you and your children, you and your adult or spouse, or you and everybody, this is going to be the most accurate information. You will notice, as we mentioned in the presentation, Health Savings Plus was purposely built to be a very low premium plan. But this is going to be where you get all of your information for open enrollment.
A couple of other questions that I've seen in here that I want to talk about. Let's see here. Okay, so there's a lot of questions about Medicare A and or just B and being enrolled in the Health Savings Plus plan for 2026. The rules remain the same today, whereas UC eligibility states that if you are enrolled in Medicare A and or B, you are not eligible for the HSP plan, nor are you eligible for the Health Savings Plus plan in 2026. If you do have additional questions about this, please contact your healthcare facilitator or benefits professional by campus or RASC. Let's see, what else can we say here? I'm looking for more questions. Let's see. Please also be careful when you are reviewing coverage of services. You want to look at your UC plans only. So going to the open enrollment tool that Jill just shared is very important. If you are searching around on Blue Shield global sites and looking through, for example, doula coverage for Medi-Cal patients, those plans are very different. In order to review the services that UC offers, you do need to stay within the UC sites to review our services. Let's see here. Looking for some other plans. Please remember also on our transition site, as well as the UCNet open enrollment page, there are plan comparisons. So you want to look at those plan comparisons, see what your coverage is on UC Care and the different tiers versus Health Savings Plus plan so that you can see what the copays, which is a single dollar amount, versus coinsurance, which is a percentage of a service that was billed, and that is after deductible. So please do visit the multiple sites that we've put out there and built for you. And don't forget that we do have 2 additional webinars like today that you can enroll. Please don't feel that you only have to enroll once. Let's see here. I also want to make sure it is clear. I've seen this question quite a few times. If you're enrolling in UC Care Tier 1 are UC providers. UC Care Tier 2 is the whole nation of Blue Shield PPO providers. And just another reminder, use the flyer that we've provided. It's in the transition site, and you will want to click on the specific links according to what plan you are trying to search for a provider in. Okay, again, Tier 1 is UC Care Tier 1 are UC providers, and there are not all providers for all services listed in Tier 1. So if you're not finding what you need, go to Tier 2 link to do your provider search. Let's see. Here. There are some questions about Accolade Care for UC Care. It is 12 visits per family member for medical and 12 visits per family member for behavioral health.
Medical can be urgent care. It could be you just are doing a follow-up visit to an annual wellness check. It's 12 medical, but then you get 12 completely separate therapy.
And just a couple of examples with Accolade Care. I personally use it quite a bit. I live in a more rural area, so I log on to my Accolade member portal, click on Accolade Care. I find a doctor that I want to see, whether male, female, whatever, and according to when they can see me. My husband uses this quite a bit. And for all things. I've actually found a primary care physician that I use when I'm not feeling well and I don't want to drive to my brick and mortar primary care physician. I also use that provider um, if I know I need to get lab work. I give them a call. I let them know what I'm feeling. They order the appropriate lab work. I go and I get the lab done, and then we schedule a follow-up visit to review those. So Accolade Care is really user-friendly. It really is on our schedule.
Everything that you do, all of your visits for Accolade Care are going to be uploaded into your app. So you can go back and review your doctor's notes. Your labs will be updated so you can review those at any time. I actually use it as a primary care. So I had my primary annual wellness visit. The doctor ordered the labs. I went and had my lab work done, and then I did schedule the follow-up visit to talk about the results. It is, what's great is it also has availability late into the evenings and on weekends. So for people who need availability outside of just the normal time frame. The therapy sessions are also fantastic. That is for 18 and above right now. But anybody, any age can use Accolade Care for medical.
One of the other questions is, what is virtual urgent care? So like we were just explaining, you log into your Accolade member portal. Once you're a member, you click on Accolade Care. Let's say you're not feeling good. Let's say you're prone to sinus infections. You give them a call, you type in what your issues are, what you're feeling, you talk to the doctor, they can see you, they'll ask you questions, and they can either even prescribe you antibiotics at the pharmacy or whatever it is you may need. So instead of going to a brick and mortar urgent care down the street and possibly catching other cooties, which is always my fear, you can get on Accolade Care and it's the exact same type of urgent care.
So just doing a quick time check, we are going to be ending the webinar here. We have all of the questions that have been submitted. If the webinar did not answer your questions, please be patient. We're going to be downloading those. We're going to make sure that we have answers back out to everybody. And again, please don't hesitate to register for another session or to even reach out and call Accolade. All of the care advocates are able to talk and answer your questions, help with your concerns on the provider searches, if you have questions about Accolade Care, if you'd like to check and make sure your prior authorizations are set up. That's really what the Accolade Care team is there to do, is your concierge member services team. But we will make sure that everyone who signed up for and attended this webinar gets a copy of the webinar and a few flyers that we shared during our presentation as well, to ensure that you have all of the resources at your fingertips so that you can really educate yourself and make an educated decision about your open enrollment this year. There are a lot of changes. We really hope that this was helpful. Anything to end the presentation with?
Oh, I hope everybody got there's a lot of questions about what is the link for the transition page. We will be sending out the deck shortly. You'll be able to click on everything in there. But I did, in the answered Q&A, I did post it quite often. So go ahead and paste it and then copy it right into your browser.
Yep. And please note that we can help you answer questions, and Accolade can help kind of guide you through it, but transition of care, continuity of care, making sure all of that happens, we cannot do that and finish that until we get into mid-December, because we have to have your medical ID numbers from Blue Shield of California in order to get that sent over to them. So we're happy to answer questions and give you the details and get you the information. But no, we have to wait until eligibility is loaded in order to send all of that information over to Blue Shield of California for them to load. And we expect eligibility to be loaded into everybody's system with all of the new eligibility information beginning of December.
One final comment I'm seeing here is a question about current medications. The plans that you're on today are coverage with Navitus. For the most part, according to the formulary, is not changing. So, of course, towards January 1st, you'll be able to look at the formulary, make sure all your medicines are still there. But that is not one of the significant changes that are being made this year. It is not affected by our transition from Anthem to Blue Shield. So I hope that gives you some assurance. You can always call Navitus as well.
Yes. Accolade and Navitus are prepared for your questions. They have all of the same information that you're being given. We are waiting for some final information to be completed by UC, like some of the finalization of the formularies for next year, but we're happy to answer questions and do everything we can to ease any concerns or anxiety you have about the transition over to Blue Shield for next year. And of course, there are some plan changes that are occurring. So please let us know, reach out to Accolade or Navitus. This will be going out to you with all that contact information, but all of those numbers are all over the open enrollment site. They're also all over the faculty staff PPO site. So please don't hesitate to reach out. And just want to again point out for Accolade, if you don't want to call in and speak to someone, you can always log in and send a message that is answered by the same team that is answering the phones. It's really your preference. I personally have found the messaging to be very convenient because I can pick it up and send a message as I'm thinking about my question. But you have a lot of resources at your fingertips to help get you ready for open enrollment. And if you are interested in the HSA, don't forget to register for the upcoming HSA webinars by Health Equity. That's going to give you some really good information and a great understanding of how to maximize your HSA for 2026. With that, we are going to end the presentation. Thank you to everyone who stayed on a little bit longer. You're welcome to attend any of our other events or reach out to the resources available to you. I hope everyone has a fantastic day. Thank you all so much, and you'll be hearing from us with all of these resources. Thank you.